Hi guys, so I had a patient that was 31 years old this past clinical week, and she came in with her partner for a well woman's exam. She was 31 years old and just like a routine pap smear was done for her. She doesn't have any comorbidities. All of her pap smears, even her last pap smear was 3 years ago, it was normal. She denies any kind of vaginal discharge or any kind of bleeding, no dysuria, no pain when she's bleeding or anything like that. She's been monogamous with her relationship with her husband. There was no change in weight loss or any change in appetite for her. For her previous medical history, she doesn't have any diabetes. She denies any hypertension. There's no dyslipidemia. She's never been hospitalized before. She doesn't have any medication allergies or any environmental allergies or food allergies. For preventative care, patient engages in regular exercise regimen, which was prescribed by her, just her primary doctor. She used to be an athlete in college and in high school, so she's still practicing like her cross-country marathons. She has a family history of breast cancer from her grandmother's side. She was diagnosed when she was 56 years old, she said, and she passed away about 8 months later. There's no other family history that she had, this patient had. Her parents were both alive and well, so I kind of educated her on just getting her breast examinations done on a yearly basis, just because she has a family history. The patient lives with her husband, and they have 3 children. All the kids are alive and well. She denies any tobacco, cigarette smoking, or any use of recreational drugs in the household. She works as a receptionist in a company. She's had that job for a couple of years. As far as review of system, patient has no reported weight loss, no change in appetite or sleeping habits. Denies any changes in hearing or vision. There's normal swallowing and reports no difficulty in swallowing. I did do like a full physical for her, not just like a well woman's or a pap smear just itself. It was like a full workup for her. So respiratory, she didn't report any cough. There's no difficulty breathing. I listened to all her lung sounds. They were all clear. Cardiovascular, she doesn't have any palpitations, no chest pain, denies any cardiac history. For gastrointestinal, we have no diarrhea, no nausea or vomiting. Patient denies having constipation and feels like she has a normal appetite. For GU, there's no vaginal bleeding, no vaginal discharge, no dysuria. Her periods are normal. She has them every month. Neurological, no changes, no denies any headaches, no memory or speech impairment. Her vital signs were all within normal limits. I'll be listing them all in the SOAP notes. For physical examination, patient looked like she was in good general health. For special examination, we did like the sterile speculation. I used the sterile speculum, and kind of did the whole pap smear. I don't think I need to describe it on here yet, but sorry about that. For visual acuity, preserved visual field was considered normal as well. Cardiovascular, once again, no normal breath sounds were heard. Normal cardiovascular heart sounds were auscultated, no added sounds. Lungs were clear, bilaterally clear on both sides. For her like her ICD, or what I kind of diagnosed her with, was that she's there for her actual checkup. And then also she's here for a gynecological exam as well. Those were basically the you know, things that I use for her. The patient has had a pap smear cytology done and reported that it was normal in the past. All women of reproductive age are encountered to undergo screening for cervical cancer, so we did that for her as well. Obviously, earlier you detect cervical cancer, the better it is for the patients. Patient was educated on the need of continuing to follow preventative care. Once again, what I mentioned to her to do the mammogram on a yearly basis, just because she has a family history. Other than that, we did a routine well woman clinic visit. Will be encouraged for adoption of a healthier lifestyle, which I think her lifestyle was mostly pretty healthy, besides maybe diet and exercise. Patient can be taught by other gynecological magazines, as well as recognition of danger signs and just kind of abuse or anything else to look out for. So we did that, and that was kind of it. I would love to hear your guys' feedback.